Hi, I'm Lindsay Diamond, and I'm presenting the Polyvocality of online COVID-19 vaccine narratives that invoke medical racism in collaboration with colleagues at the University of Colorado Boulder. In June 2020 in Denver, Colorado, two distinct groups gathered in protest. The streets were filled with people marching in support of the Black Lives Matter movement. Meanwhile, surrounding the nearby state capitol, anti-vaccine activists gathered in protest of a vaccine-related bill. The anti-vaccine protest drew prominent activists such as Robert F. Kennedy Jr., as well as the local chapters of the Proud Boys, gun rights activists, and other alt-right and conservative supporters. At one point during the confluence of protesters, anti-vaccine activists yelled out to the Black Lives Matter marchers to remember Tuskegee and to refuse the COVID-19 vaccine. Remember Tuskegee is in reference to the Tuskegee Syphilis Study, a 40-year collaboration between the U.S. Public Health Service and the Tuskegee Institute designed to study the natural course of syphilis in Black men. Importantly, researchers did not collect informed consent, and by 1943, when penicillin became the widely available treatment of choice for syphilis, the participants in the study were not offered it. It's important to note that the misrepresentation of the events of the Tuskegee Syphilis Study is a frequent occurrence and meaningful in our data collection. We show that an overwhelming majority of vaccine distrustful social media users mistakenly refer to the events of the study as the participants having been given syphilis, and sometimes more specifically through use of vaccines. So much so that it has become a false narrative that nevertheless sounds plausible. The atrocity of Tuskegee was in denying care, but no participants were given syphilis. For as long as there have been vaccines, there has been vaccine hesitancy. The Anti-Vaccination Society of America was founded in 1879. In the modern era of anti-vaccine activism, racial targeting is not new. There's history of targeting minorities, including Orthodox Jewish communities in New York and Somali communities in Minnesota. The anti-vaccine movement has expanded and begs the question, what happens when those who fear or doubt vaccines out of mistrust of the government, political party, or scientific authority see a new frontier to evangelize to those who are legitimately fearful of medical racism? Our research aims to understand how those who are concerned about medical racism speak about vaccine compliance concerns in relation to the COVID-19 pandemic. Whether disinformation activity that exploits medical racism is happening, and to what extent spaces that are traditionally the province of Black Twitter are infiltrated by people with intent to disrupt. We examined a discussion space on Twitter created by the combined invocation of the Tuskegee Syphilis Study and vaccinations to understand how vaccine trust and medical racism are argued. The co-occurrence of these terms dramatically increases during the pandemic, and we were interested to understand who participates in this space and what do they aim to do with their postings. Our data collection is organized around February 1st, 2020, as the transition from pre-pandemic to peri-pandemic. The collection and subsequent analysis of Twitter data was to enable a qualitative inductive thematic analysis of vaccine discourse and speakers, and to build network graphs to visualize the interactions of those voices. Through empirical inspection, we created thresholds to narrow our 17,000 tweet collection down to 538 accounts with a total of 3,000 tweets. Through our qualitative examination, we discover a polyvocality of voices writing about the relationship between medical racism and vaccine compliance. Polyvocality describes the mixed space of positions, agendas, and the resulting logics. We did not have any preset categories or features of identity, but rather the account's publicized forms of religious, political, and racial identities gave rise to 12 distinct voices. We provide in-depth qualitative descriptions of the 12 voices in the paper. And for the sake of time, I'll introduce what the conversation space looked like before and during the pandemic. In the pre-pandemic period, a noteworthy observation was that the voice of distrustful users who invoke political conservatism and who are not Black presenting dominated this conversation space, a conversation around Tuskegee and vaccines. In the peri-pandemic period, we see a rise in distrustful voices from Black presenting users, including those who publicize their affiliations with the Nation of Islam and lineage and reparations movements such as American Descendants of Slavery and Foundational Black Americans. We also see a significant rise in the pro-vaccine Black presenting users, many of whom are doctors, scientists, and media personalities occupying this space to debunk misinformation. We turn to the network graphs to better understand how the voices interact with each other. The network graphs contain the full account monologues amounting to 19 million tweets. Nodes represent accounts, and edges represent a mention or interaction between accounts. We see most accounts in each voice are clustered near each other, and neighboring voices are adjacent. During the pre-pandemic period, we see clusters of voices that fall along social, political, and racial lines. However, this shifts in the peri-pandemic period as the voices begin acting in new ways. During the peri-pandemic period, we see the production of more anti-vaccine content that targets communities of color and is subsequently shared through various networks. The Black presenting pro-vaccine accounts increase in presence and volume as they carry the burden of debunking misinformation coming from voices on all sides. When we home in on just the vaccine distrustful voices, we see that those largely distinct vaccine distrust superclusters had little interaction prior to the pandemic. Yet the number of interactions grew significantly, up 84% during the pandemic. Through this longitudinal and comparative exploration, we find a polyvocal space consisting of users who share messages with different underlying values, those who share the same underlying values but spread different messages, and those whose purpose is to confuse the space with rhetoric that falls along social or political party lines. The truth of the Tuskegee Syphilis Study is so offensive that it takes a moment to explain that parts of it are hijacked or exploited to tell untruths that yet further harm. We discuss disinformation as a foreground-background trick. It ostensibly speaks to one foregrounded issue, but cleverly keeps its consumers blind to the real agenda, which lurks in the background and often requires the ability to read longitudinally and across the multiplicity of voices to detect. This is what we call polyvocal readership. The foregrounded topic is a masquerade and wastes the labor of its defenders who attempt to dispute, dispel, and educate. We know this is true with the topic of vaccines, as there are plenty of other aspects of medical racism that persist and are signaled directly by the lessons of the Tuskegee Syphilis Study. Yet instead of addressing topics of equity or access, anti-vaccine activists co-opt medical racism for political purposes and deny the value of vaccines altogether. In terms of platforms, we face the issue that Twitter as a platform is the de facto proxy for validity. If an account can be created, Twitter automatically deems the voice with which it speaks to be valid. It is technology as authority. There are opportunities for building in design frictions, but perhaps the obligation of who should feel the weight of the design friction is not the users, but the platform corporations themselves. What can the crowd, the machines, and the policies that govern machines do about exploitative distortions of truth? Disinformation is not just a collection of single pieces of incorrect information. Its production is wrapped up in positionality and intention to attack in uncertain situations. Sophisticated disinformation efforts exploit by co-opting elements from unrelated collective movements and destabilizing logics. Ease of platform use favors the ability to disinform. Human and machine methods of removing acts of disinformation and repeated acts of misinformation are required, but so too are features, tools, visualizations, and policies that augment the human experience and enable polyvocal readership of the mix of valid, questionable, and predatory voices that coexist in emergent discussion spaces. Thank you for your time.